thank you all for taking the time to come out in this cold Florida weather. I'd be glad you're not up north. Okay? It's a lot worse up there, as a matter of fact. One of the things we're going to start doing to Tuesday Talk, we have so many great programs going on around, and we have a lot of new people. So we're going to start off the Tuesday Talks by telling you about some of the programs that we have. And the program this morning we have is Regency Oaks Arts Class Installation, run by the lady who runs almost everything on our campus, okay, Johanna. And I'm going to go back and operate the slides for her, and she's going to take over and tell you about Regency Oaks Arts Class Installations. So please, go ahead.
I think I'm going to tell you about one of the oldest continuous in use function that we have here at Regency Oaks. Every Thursday at 11 o'clock to 12:30 in the Arts and Crafts room, we have an art class. And for over 16 years, the same art teacher, Tony, has been coming to Regency Oaks, bringing us ideas to stimulate us to create. To join the group, you don't have to admit to being an artist. Tony will help bring out some hidden talent you don't even know you have, as many in the class have discovered. Not everyone is actually painting a picture, and not every time you come there do we paint pictures. There are some craft projects. The new ideas are always introduced, like learning how to use Yupo paper, or using alcohol inks to create a one-of-a-kind scarf. You couldn't meet a group of more caring or sharing people as those in the art class. For if nothing else, just come around and meet this group of men and women who care about you. One Thursday, Tony brought in a few pink flamingos. Of course, Florida has always had that funkiness about plastic pink flamingos. Well, the class got very excited about decorating them. They put on feathers and sequences and pearls and painted them many colors. And then we shared them by letting them graze in the garden al fresco area and along the shuffleboard court. Some residents thought they were tacky, and we loved tacky. But it certainly was something to talk about. An owl visited one of our oak trees and had some owlets tucked away in a hole in the tree. The art class used the owl as a theme for decorating pine cones to look like owls. They were displayed on our white tree. Now, this white tree changes themes with every holiday. From time to time, the tree will be decorated with valentines or pumpkins or snowflakes or witches, you just name it. We were asked by marketing to display something in the sales office to show the art activity at Regency Oaks. We created this display of ferns. Each person in class learned how to stencil a fern. For the Wellness Center, we gathered 12 canvases. Everybody had the same color paint and created different backgrounds with it. And then the Tree of Life was drawn on top of that. Halloween brought out the witches' hats. Then for Christmas, we decorated cylindrical cones to resemble angels. Each person could create their own design. They were displayed in both the North and the South lobbies. When we had themed dinners here representing various countries, the class created these pictures of their representation of Peru. Then they were displayed in the training room. We never miss a spot to display our artwork. The computer room was developed, and we decorated all of the walls with our interpretation of computer-inspired art. Now, when the Grand Lobby South is in use, you can go on that pass passageway around it. Well, the walls in there were just begging for something of interest to them. The art class rescued them. They painted the walls, and then we had these paintings put up, and we changed them from time to time. So as you go around the Grand Lobby South, take a look at the artwork. Now here's an example of one of the monthly craft classes. The class and participants keep active. There's always room for more. Come, give it a try. All of the supplies are furnished. Just show up on Thursday and get inspired.
Good morning. While Brent's getting set up, I'm going to give you a few updates and activities. Thank you so much, Johanna, for your presentation this morning. Just a reminder, we are doing our community spotlights each Tuesday. We have a full calendar, so please feel free to contact me. You can email me or give me a call at my office if you would like to have your group spotlighted. It doesn't have to be an activity. It can be even if you get together with your, if you go to the dining room, you're looking for new friends to join you, please, or even if you eat in the breezeway or have a few cocktails, you know, that's a perfect opportunity to meet new people. So we're looking forward to seeing the community spotlights grow. Also, I wanted to let you know that Pastor Chuck, he was our Protestant pastor here before we got Jim Roy. His church is actually collecting shoes this time of the year. So we will have a box in each lobby by Friday to take collections for the shoes. They're taking women's, men's, children's shoes, no socks. But if you have any shoes that you would like to donate, he is doing that until March 31st. So you have quite a bit of time to be able to do that. He will be making pickups until that time, but if you have any shoes you would like to donate, any size, it could be sandals, anything that you're looking to get rid of, we would love to have it. Also, I would like to let you know that we're doing a sign up for a sign language class. I know that we have Spanish right now, and we've seen the interest for sign language. Multiple means of communication is always great. You know, learning something new is a perfect opportunity. So we will have that sign up in each lobby by Friday as well.
Who's leading it?
That's going to be led by Mary Ellen. So she has done sign language before, so she's looking forward to bringing it back on campus.
All right, good morning and welcome again, everybody. Delighted that you're here on this chilly day. I did learn from Walter that the COVID clinic, which is scheduled for this Saturday, we don't have a time, but we do have the date. And Walter was able to tell us, he put his weatherman's cap on, and he assures us that the temperatures Saturday are going to be back in the 70s. So it'll be good for us to be able to be outside queuing up for the second shot. All right, we're going to start by going to the whiteboard, and Tiffany and I are going to get repositioned. What I wanted to do today is take a look at something we don't look at a lot here, but this is something that we look at on a time-to-time basis. It's the IHME, it's the International Health Metrics Organization. And this is a group of COVID scientists that have get together and they do forecasting. They look at the current situation and what they think tomorrow is going to look like and what trends are they picking up. And so I just wanted to take the latest briefing that they had provided and share 2 or 3 paragraphs that I thought you might find interesting. I did. And so Don, first slide, please. So daily reported cases in this last week of February decreased from a high of 14,010 the week before to 11,400 per day. So this is in the state of Florida, and so we saw a decline of about 3,000 people per day in new cases. This continues to support the data that we look at every week on the trend lines. And so the current situation is we are in a decline, both in terms of deaths and in terms of number of new cases. The second bullet point is the number of deaths in Florida were 170. It says it decreased, but it actually was 170 the prior week. If you looked at it over a 3 or a 4 week period, you would see that the number of deaths have decreased by almost a third. So again, the two trends that are really important that we track, we continue to see improvement here in Florida. Forget the R factor for just a minute. We're going to go right down to the fourth bullet point. 16% of the people in Florida have now been identified as either having had COVID or currently having COVID. So you had it or you have recovered. And that's important. We track that number because we know that herd immunity is how we eventually will defeat COVID. And so there are two ways to build herd immunity. You either can get the disease and recover, or you can get the vaccination. And one of the interesting things that I read that I didn't know, and I wanted to share this, is we look at that efficacy rate, the effectiveness rate, and I had always sort of assumed when you have that second booster shot and 7 days after, your efficacy rate goes to about 95%. Here's the statistic that I didn't realize. The efficacy rate is referring to your likelihood of catching, not of catching COVID, but of catching a mild case or of catching a medium to severe case of COVID and ending up in a hospital or expiring from the disease. And so one of the statistics that you do not see out there in the state of Florida so far, anyone who has received the second booster and gone 7 days, there has not been a fatality from COVID. And so the efficacy rate, when we talk about 95%, it's not talking about your opportunity of catching a mild case of COVID. It's talking about the likelihood of you catching a more severe case of COVID that would result in your hospitalization or your death. And so those are really encouraging statistics, seeing how we're getting ready to have our second booster shot, and you soon will have efficacy for that. The daily death rate is greater than four people per million in 44 states. So that's sort of the national picture. Our efficacy rate is at 0.94, so we're less than 1%. So you can see that the vast majority of our states, 44 of them, have efficacy rates 4 times higher than what we see here in Florida. So I know it's really nerve-wracking when you go onto the Johns Hopkins site or you listen to the news and they talk about how this has become. It's really a tough time right now, and the contagion rates are high. But that is tending not to be true here in the state of Florida. So that's our current situation. Let's flip to the next chart. I know you can't read this, but let me just share some of the important information. That second one is mobility. We've seen they track mobility through cell phones. They look at how far they take your cell phone in mass data and determine how far you have traveled from your base location. And so if your cell phone doesn't move for 12 hours, they determine that's your base location, and then they track it. And they can see whether you go 1 mile, 3 miles, 5 miles, 50 miles from the community. They can find and identify hospitals and malls so that they can look at traffic patterns and flows. So anyway, they've been tracking mobility this week over week, and last week it was 25% lower than the baseline, which was taken in February this time last year. And so when we talk about social mobility, we are seeing a decline of about 25%. Now, it fell to an all-time low back in late April, early May of last year, and we saw about 50% of the people staying put and not going out, not going to work, not going to shopping, not going to malls and to restaurants. So a lot of people have said to me, well, have you noticed that there's more traffic back on the streets? Everybody seems to be getting more either comfortable or less cautious, and they're going out and exploring more. And that's not actually been the case. These are the these are the mobility numbers for the state of Florida. And it's been at about 25% since probably late August. So not much change in that. As of January 25th, we estimate that 73% of people are wearing masks. Now, this is a national number, not a Florida number, and mask use was lower than 50% in no states. There wasn't a single one of the 50 states that was reporting mask usage of less than 50%. So those numbers are really up from where they were earlier in the beginning stage of this disease. There were 230 diagnostic tests per 100,000 people. This is a national number as well. I just sort of combined some of these national, state, and local numbers. But this is significant in my mind because we are still struggling with the ability to do a test for COVID. They're hard to get. They're very time consuming. You can go down to Ruth Eckerd Hall and you can sit in that car for a couple hours and you can get that test if it's available. And so this continues to be a challenge that the new administration, the Department of Health, is having to overcome. Now, I've got some good news to share, and I probably should do this off the TV, but you should only know this if you show up to Tuesday Talk. We have gotten a hold of several hundred rapid tests for use in the IL. And so this is the first time we've had that capability, and we've gotten it through the emergency use provisions that the governor has set forth. And so I now have the ability to, if I have an outbreak or a suspected outbreak, and I'm concerned about it spreading in a segment of our building, or we have a resident who's had an exposure, tested positive, and I have 5 other residents that I'm concerned about because you've had a direct exposure. Rather than putting you in quarantine and you not being able to know your status for the next 14 days, I now have the ability to use a rapid test to give you instant peace of mind that even though you may have had a direct exposure, you're not COVID positive. And so that capability, we just acquired those rapid tests, and that's going to be another game changer for us as we learn to manage COVID and prevent the spread of the disease. In Florida, 48.2% of the people say that they would accept a COVID vaccine, and 25.6% of the people are not sure if they would accept. The remainder say, absolutely, I'm not going to get vaccinated. Have no idea why that is so low. To me, that is nonsense. It's craziness. I think every resident, every staff member, every family member needs to be vaccinated. I believe that. Here at Regency Oaks, we have done a pretty good job. When we think about our residents, there are 456 residents. We've had 332 residents receive the first dose of the vaccine. We have an additional 48 residents who have signed up to receive their first dose of the vaccine this Saturday. And we have about 20 residents that we have identified as having received the vaccine someplace other than Regency Oaks. So we're going to get over 400 of our 456 residents.
We also suspect, and this is an ask, I'm asking for a favor, if you or someone you know has had the vaccine outside of Regency Oaks, you went to your doctors or your doctor arranged for you to go to Baycare and get it through one of their clinics, if you could notify us at the front desk so that we could, we don't need your lot number and which vaccine you received. We just want to be able to check you off of a list so that we know which of our residents have received the vaccine either here or off campus. So if I could ask you to help me spread the word on that, we're trying to capture as many folks as we can. We expect here in Florida, this is a Florida number, we expect about 12 million people to be vaccinated by May 1st. Our vaccination here in the United States, we've been able to get 34 million shots in arms across the United States, and Florida hopes to have 12 million done by May 1st. We'll look ahead. And so just a couple of things that I wanted to look at here. So they've been coming up with different scenarios and trying to model out what they think is going to happen and how it's going to impact us. And there are essentially two scenarios they're looking at. And the first scenario is it's going to continue just as it is. The second scenario is that we're going to have these mutant forms of the virus impact us. Two of the three mutant forms they think are very effective to the Pfizer vaccine. One they are less confident in, but just some of the key figures. Our projected models, cumulative deaths by May 1st is they're going to anticipate a rise to 38,000. That's 12,000 new deaths between January 25th and May 1st. The good news is the daily deaths will peak on January 26th. So they think that the worst of this is behind us, not in front of us. So again, that just continues to support all the data that we're looking at that says we've rounded the turn on this. The curve is we're on the descent of the curve. Interesting statistic, by May 1st of this year, they project that the vaccine is going to save 2,800 lives. That's a great number. They also are saying if we could get to universal mass coverage, right now we're at 70, mid-70s, they're saying if we could bump that up to universal, and that's considered 95%, they could save an additional 3,000 lives by just raising the number of people who are wearing masks out in public. And here's interesting, last point. The worst case scenario, even given the mutations in the virus, and even given the fact that people mask wearing may continue to decline instead of increase, the worst case scenario is they're only projecting 40,000 cumulative deaths instead of the 38,000. So if everything goes wrong and we don't continue to make improvements and we don't see an increased number of vaccines and we're not wearing the mask when we're supposed to, we're only going to see an additional 2,000 deaths over what they're already projecting. So the trend lines are all positive, and the statistical data is saying that we're moving beyond this. We've rounded the curve. Look at two things right here. The two charts over on the right-hand side. The yellow chart is the new cases, and that's back to the first day of the year through the month of January. You can see that first week it was trending up. And then ever since it's been coming down. You see about every week, you see those spikes there at like 113 and 128. Why those spikes exist is They test on Friday, Monday, Tuesday, Wednesday, Thursday, Friday, and those tests go in every day. They test on Saturday and Sunday, but they don't report the figures. They do the testing, but they don't report the figures. So what happens on Monday, the figures are much, much higher, and so you see a spike every Monday of every week. And so if you take out those spikes and try to look for a line trajectory, you can see that overall there's a decline. And I'm going to show you another example of that in just a minute. The bottom chart on the right-hand side in white, those are the number of fatalities on a daily basis from COVID, and you can see it continues to decline. Now, interesting enough, one of the points on the last slide that I didn't make, but I'll make now, is even though we see a tremendous number of decline, last week, COVID was the #1 cause of fatalities in the state of Florida. So it's still it's out there, and it's killing more people than heart disease or cancer or car wrecks. Okay, let's go to testing. Next one over. A couple of things I want to look at here. You can look down here at the bottom. We have the line graph, and you can see this is the positivity rate for our county. And you can see it spiked. We were getting up around 12, 13. And then it's just steadily declined. It's now dropped below the 10%. And here is that point I was going to make. You can see that yesterday they had a positivity rate, of, I'm going to restate that. Mm-hmm. Today's positivity rate is 8.39%. Yesterday's positivity rate, which had more tests, because it included the Saturday, Sunday collection and data dump, the positivity rate yesterday on triple the testing was 3.93%. So that's one of the things that's indicative. It's why we see a continued drop. Is the larger the sample, it tends to be the lower the positivity rate. So we're headed in the right direction, and these numbers look great. Let's go over to case maps. We haven't looked at any of the maps here for 3 or 4 weeks because they've just looked awful. And we only want to look at the positive news, but here's some good news. You can see Tampa, Hillsborough, is that dark red. They're having some problems over there. Their cases yesterday is more than 677 new cases in Hillsborough. But if you look here at Tampa, to the left of Tampa, you see Pinellas County, and our count rate is right up here at the 98 or 98 to 221. So we have, over the last couple of weeks, seen that we have dropped our positivity rates. Instead of being at the top of the chart, we're now at the middle of the chart. So there is some indication that things are looking good. And don't go to Miami. No matter what, don't go to Miami. That's the answer. And then Don, let's go look at health metrics. Okay, health metrics, look at this every week. These are the 4 charts that really tell the story. The brown chart, upper left-hand corner, these are the number of people presenting in hospital or emergency urgent care clinics for influenza or flu. You can see it's sort of stable. The same number of people, or the people reporting to hospitals and urgent care centers with COVID-like symptoms, that's the purple graph in the left-hand corner, that continues to decline. And you can see that's now a 4-week decline, and that is a clear trend line, and it continues to be very encouraging. Documented new cases, the upper corner in yellow, continues to decline, as does the curative testing, the lab testing for COVID, with a continued decline in the positivity rate, dropping below the 10%. So that's important because a couple of things have to happen, but from why you're concerned about that is we're not able to take the next steps in terms of reopening until we fall below that 10%. So if the trend line continues, we think it will, we're going to see that positivity rate continue to fall over the course of the next 3 to 4 weeks, just about the same time that you are going to have efficacy 7 days post your booster shot. So all the numbers are looking good, and let's take a look at Regency Oaks specific numbers.
Okay. All right, ready? Mm-hmm. So yesterday in Pinellas County, we only had 23 people hospitalized because of COVID. Pinellas County, over 1 million people. Those numbers are great. The number of people who expired from COVID yesterday in Pinellas County jumped by 2. So again, we're seeing decreased hospitalization, improvement in the number of people who are getting the disease, and we're also seeing a decline in the number of people who pass from it. Here in the IL, I have 13 people that are under quarantine. The vast majority of them are because they traveled, because they had a hospitalization. There is no one in the IL who is, there is only one person in the IL who is currently under quarantine because of COVID. In our staff, you know that we had an outbreak last week in our dining services, and we had 8 people who had an exposure. Fortunately, it turned out that only one of those individuals actually ended up being COVID positive. Everybody else who was on quarantine is now off, with the exception of 2 more that we're monitoring, but they are not showing COVID-like symptoms, and they have tested negative. So there's still a couple of days of quarantine left for them. You may have noticed that the tavern has reopened as of this morning, and that's because our staff members have been able to come back from quarantine and get them back into the tavern. Flu symptoms, testing in progress, residents, staff, all product lines, assisted living, skilled nursing, independent living. We have 0 residents or staff we suspect of having COVID or are testing. So that is a great number. So that sort of concludes our COVID talk. We're already out of time. We may have to move these Tuesday talks to an hour and a half. One last thing I do want to share, a piece of sad news. If you haven't heard, Michelle Weissman passed away yesterday. She survived by her husband Jesse and two sons and a grandchild, a longtime associate of 17 years. So she will be missed. Keep her in your thoughts and prayers, and we're going to reach out and try to make sure she gets cards, and as funeral arrangements become known, we'll share that with you as well. All right. Thank you very much. We're going to open it up for questions and answers. Just wait on a microphone. We have a mic, right? Mm-hmm. Right here. Okay.
We're almost coming up on a year. We enjoy Regency. One of the important amenities to us is the tavern. We are frequently down there at 7:30 in the morning, waiting for the 8 o'clock opening. We actually has formed an informal little breakfast club with getting to meet new residents, getting to meet other people. My issue, I guess, several times we've made the trip from the south to the tavern, only to find a sign on the door, closed. Yesterday at dinner, we were informed by the dining administration the tavern will be open, but not for breakfast. It'll be closed for breakfast and open for dinner. As I walked in here, talked with one of the Breakfast Club folks, found out that there were only 3 people that showed up in the early morning. What I'm asking for is better messaging. Thank you.
So, that continues to be the challenge of Regency Oaks is, how do we better communicate? And it's something that we continue to work on. It's a priority for our goals and objectives. It was last year. It is this year. We've made some tremendous gains this past year. The ability to videotape our message, the opportunity to use our new Call 'em All. But that is something that is an area that we constantly are working on to try to improve. It's difficult when you think about how we communicate. We have our standard is to communicate something in 5 different ways, and we identified all the different ways we can communicate, and we came up with like 14 different ways. And so whether we're using a Call 'em All, posting it in the elevator, making a public service announcement on 732, putting a flyer in your box, posting it on the whiteboard in both lobbies, we're trying to communicate things 5 different ways so that we reach the largest number of residents. The other thing that is really difficult in a community this large without a direct communication method to residents is to get things communicated as they happen. Our communication doesn't tend to be real time. It lags behind. But that is something that we are going to continue to work on. We think that this year, as we focus on getting our in-house TV studio up and running, that's going to make a difference. It's going to give us a second TV channel to communicate daily updates so that you have one channel for information and one channel for entertainment and activities. So thank you. Good comment. I agree with it, and it is one of our priorities this year.
I think we're all reassured by your explanations this morning of the declining rates of COVID-19 in Florida and Pinellas. And we're all reassured by the fact we're going to be getting a shot on Saturday and completing our immunization. But as the epidemiology professor from the University of Minnesota likes to point out, it's like we have a Class 5 hurricane 430 miles offshore. And to talk about that is very speculative, but in the scientific comments, there's quite a bit of agreement that we are going to be hit by various variants that are going to turn those statistics around, and possibly quite notably.
So there, to Bill's point, is there are some mutations. At this point, there are 3 scientifically recognized mutations. There's a 4th one out there that they haven't been able to confirm because there has to be an X number of diagnoses to support a mutation, and they just don't have it on the 4th one. 2 of the mutant forms of COVID out there, they believe are going to. They believe both the Pfizer and the Moderna vaccines are effective against. The 3rd, they have determined that it is not effective against. And so that is a wild card that is out there. They also know that as these mutant forms of the RNA are being developed, that they're more dangerous. It's a 76% increase in the spread rate. And so it's 3 times more dangerous than the current COVID vaccine. They also know that it's more deadly. It's about 30% more deadly. But that's why I wanted to stress the importance of what the definition of efficacy means. You may get COVID, you may get one of the COVID mutant forms that's more contagious and more deadly, but the vaccination gives you that 95% efficacy against getting a severe case of one of these diseases that's going to result in your hospitalization or death. And so you may have seen the strategy has sort of changed in the United States. The Biden administration has said it is more important, because of what's coming, that we get a single vaccine in every senior's arm than it is to get the second vaccine. And so your second shot is guaranteed, but when we get to the 1C category, we're in 1A right now. When we get to the 1C category, which is individuals over the age of 65, it is probable that they may only be getting a single vaccine because the Biden administration has said we'd rather take that second dose and get it into additional arms rather than giving people a second dose. And so that discussion is being held at the national level with CDC and Biden's COVID task force. But you're right, there's stuff out there that we need to be alert to and wary of. Good point. All right, I think we have a second mic. Yeah. All right, we'll come right back to you, Judy, while Don tries to get this mic going. Go ahead with there we go.
Just a quick question about Saturday's procedure. I know we were given random letters from the alphabet. Now, when we get called, are they going to go in alphabetical order, or is it going to be random again?
It's going to be random. And so we tried to come up with a way to keep this, fair for everybody, so that it didn't matter whether you were the first in line or the last in line. You had an equal chance, and we will call the numbers on a random basis. The letters, thank you, on a random basis. We don't have a time yet on when they're going to get here. And so as we get that information and we get that confirmed, we'll try to break it up into more manageable windows so that we can tell you, look, you only need to be available between the hours of 10 and 1, or between 1 and 3, or between 3 and 6. So we'll try to give you a window so that we don't consume your entire day. But until we know what time they actually are going to be here, we're not able to do that. So more is coming on that as soon as we get confirmation. Go ahead and I'll repeat your question, Judy.
I have 2 things. Last week, the South Building was without water and no Colomol. And 2, to this gentleman's comment, why didn't you send out a Colomol yesterday afternoon when you knew the tavern would be open this morning?
Yeah. So I have no idea. Were we out of water? Does anyone know anything about water in the South Building?
Was the plumber. And that's not satisfactory. You should have been warned. You may be without water.
Well, so I didn't know we were out of water, so I don't have anything to report on that. And so so I can find out more. How long were you without water?
Well, I wasn't here, but a neighbor told me it was over an hour.
Yeah.
And it was in the middle of the morning.
Yeah. So I just don't know.
My second one is, I thought it was 14 days after the second injection. You said 7.
7.
Just 7?
It's 7.
My doctor's son-in-law says it's 14.
He's wrong. So, and so here's the thing. Yes, so we have the ability to do call-em-alls. We've sort of made the decision that, I don't want to be blowing up your phone 15 times a day with useless information that isn't going to change your life. So we have this great technology and we ought to utilize it, but and so this is part of the policy that we're going to have to write as a community, not just me. I mean, it's going to be from residents, your input as well. But do you want me calling you to, tell you that, the tavern is going to open at 7:30 instead, or at 8:30 instead of 7:30, or that we are having pot roast substituting for meatloaf tonight. And so as we go forward with this new technology, part of what we're going to have to do as a community, not Brant Smith, but as a community, we're going to have to set some protocols as to what information you want to receive and what information you don't need to receive. Because we can very easily get to the point where we literally are sending you 15 robocalls a day. I don't think that's the right way to go. So that is something that's going to develop as we get used to this new technology. Great point.
This came up in Bridge last night. We were talking about we get our COVID shots and we're all fine. Are the people we then go interact with fine? Can I carry it on my clothes or something and give it to somebody, or are we carriers after we've been vaccinated?
Great question. So once you have been vaccinated and you've gone through your 14-day period, you can carry the disease, you can get the disease, that does not change. And so your exposure risk is no different than anyone who has not had the vaccine. What the vaccine does is if you get COVID, it's going to make sure that it's a mild case with very mild symptoms, as opposed to something that becomes more dangerous and results in a hospitalization or death. The vaccine has no change to the likelihood of you getting or not getting COVID. It just prevents it from becoming a serious health risk for you and anyone who's had it. Now, one other thing, and we'll talk about this, but when you have COVID, you will continue to test positive for COVID for many, many months after you have COVID. And so you need to be aware of that as you think about, there is going to come a time where you're going to have a vaccination card, just like you used to have a vaccination card to get your kids into school. We're probably going to see that. You're going to have a vaccine card in order to get on a cruise ship, go to a hotel, and so that may happen. But once you have COVID, you're going to test positive because the antigens are in your body. There is some question as to whether or not, once you complete your vaccine process, as to whether or not you are also going to test positive. Because remember, when we talked about the COVID vaccine, it's really nothing more than the infection that they're putting into your system. And that's why we have so many people who, more than 50% of the people who say they're not going to take it or they're not sure, is because they have that whole problem with the vaccine. So there's more data that we're going to have to study and get a handle on as we begin to roll this out and see how it impacts us.
This is going back to a subject, but the robocalls can be very intrusive, I understand. But sometimes we need to know. And can you consider maybe doing text messages? That way, maybe half of us will get them, and we can pass it around to those that we know.
Yeah. So I get it, and so this is new technology. We don't have protocols set up. I get that, and so we'll maybe this is a task we can turn over. We have a communication. It's a goal for this year. We have a couple of rose holders that we have appointed who have a subcommittee to study this, and that maybe that's one of the things we should task them with, is setting up the communication protocols for what we should use, call them all for the robocalls, and help us define what we need to send out to residents, because we don't know. I mean, we don't know right now. And so maybe that's a task, Don, we can pass on to our subcommittee. Thank you. Jerry, we got a mic coming.
Hi. Who is this Kyle person that we've been getting robocalls from? And if he's going to replace you, we don't want him.
Okay. Well, thank you. And so Kyle is in a brand new position for Regency Oaks, and his title is he's the Associate Executive Director. And so in my absence, we now have someone who takes over. Previously, when we had Rance Macy as our skilled nursing home administrator, when I was out of the building, there was nobody who stepped into the role. And so we've just changed the organizational structure a little bit. And so now we have a formal replacement for me when I am not here, and that's Kyle. Kyle is not my replacement. I am not retiring. I'm 65, and so I got Medicare this year, but I still plan to work through 68, and if my health continues maybe a little longer, I still have fun at this. Pat says I can't stay home with her. She makes me get up and go to work every day. So he's not my replacement. But here's what will probably happen to Kyle. Kyle he's bright, he's young, he is really, really talented. He's been with our organization since he was a kid. And he has good skilled nursing background. He doesn't have any experience with independent living. So we're going to train and orient him, and he probably is going to get promoted at some point to an executive director's position, but it's just not going to be here.
Would you please ask him to speak more slowly?
Speak slowly, okay.
So that we can connect with him a little bit better.
Gotcha.
I mean, Kyle from nowhere is telling you what to do.
Yeah.
And
So here's the deal. It depends, and this is where we need protocol. If you're getting a robocall from Kyle or Travis, it probably doesn't pertain to you. It's a nursing home call. If you're getting it from Sandra, it's probably a staff robocall. If you're getting it from Leslie or me, it probably pertains to you. And so it's just becoming very evident that what we really need to work on is setting up a protocol for how to use these robocalls and better communicate with residents. So that's a commitment Don and I will make, and we'll task our committee to focus in on this sooner rather than later.
Brian, I thought we were told that there was no COVID in the vaccine that you got. I mean, that's what I thought all the people in the news were saying.
No.
It's not alive. It's not alive. It's not alive.
Well, it's an antigen, and so I don't know whether, I'm not enough of a scientist to define whether an antigen is a microorganism that is alive or not. That's way over my head.
Maybe they've said it's not a live virus in it, maybe. No?
That is over my science grade.
I think it works pretty much like a regular flu shot.
It works
in a way,
it works
in the
exact-
same way.
it-
I mean, when you get a flu shot, that's not going to guarantee you that you do not get the flu. It's just going to make it easier on you if you do. And that is not a live flu virus. And it's my understanding that this is not a live COVID virus. It's just to, as you have thoroughly explained this morning, to prevent us from hopefully dying from it.
Yeah. And so they inject the antigen into the muscle so that the body can develop an immune reaction to that specific antigen that is found in COVID. And that's how that expires in 2 to 3 weeks. Remember, we talked about how that completely expires from your system. And at that point, your body has roadmapped a white blood cell response to the antigen. And that's how the immunization actually occurs. And so it's an antigen. I can't go any further than that.
And if you could test positive from then on, why would it even pay you to get a test?
Well, because so it's like when you go and get the flu, they just don't know yet because it's too early to know. But when you go and if you go and get a flu shot and you 2 weeks later go to your doctor and he does blood work, is it going to show flu in your system? Yes. Yeah. Yeah. And so they think it's probably going to be just like that. But you know, they only started administering these vaccines back in the middle of December. So their long-term prognosis is 30 days. They don't know anything. And so we just don't know what is that going to look like at 45 days or 60 or 90 or 120 days. And so that's all they're saying is that they don't know they don't know the answer because they don't have enough case history at this point.
I would just like to say that I think you and your staff are doing a fantastic job for all that we've been through, are going to go through, and beyond. God bless you, and God be with you and your staff.
Thank you, Maddie. Thank you.
So benediction.
All right. So thank you very much. Really appreciate you coming out, and we'll see you Saturday.